So while we are dealing with the school refusals over here, in a lot of children, we go about and see these school refusals. Now, what is the age group that is affected due to these school refusals? It can be the children under 10, or it can even be the adolescent age group that is affected. So the prognosis is quite difficult when we are dealing with children and when we are dealing with adolescents. Usually the adults do not respond quite significantly when we offer those cognitive behavioral therapies and the counseling sessions. Due to this phenomena, the school refusals are quite common in these individuals, and sometimes they fail to get back and get that appropriate education that they need. So as a psychiatrist, as a practicing clinician, one should know how to deal with these school refusals, and one should know how to basically go about and solve these school refusals through the cognitive behavioral therapy and sometimes through the medications or pharmacotherapies if they are needed. Now, what is basically the causative factors that is leading to the development of these school refusals? It can be the unsecured attachment that the child has developed with the primary caregiver in the early childhood. Then there can be a lot of incidents in the early childhood of that individual that we are dealing in, and that is basically leading into the development of the post-traumatic stress disorder, that is leading into those panic attacks, that is leading to the development of those anxiety disorders that the child is going to develop throughout his life. So the development of that anxiety, the development of that panic has to be investigated in a proper way when we are dealing with these children who are basically suffering from the school refusal. Now, the factors that are basically leading into the development of the school refusal: you have a kid at your hand and the parents are basically complaining of this fact that the child is refusing to go to school. There are multiple factors involved. It can be the unsecured attachment. It can be the environment of the school. So the investigation should be in a more practical way. One should go and visit the school himself or herself just to get to know the knowledge of the kind of teachers, the kind of environment the child is basically facing in the school, as well as the environment that the child is facing at the home is again very important. So the environmental factors, the kind of the familial pressures that he's going to have, all of these are going to play a very important role when we are dealing with these school refusals. The separation anxiety and school refusals, they are sometimes interlinked. So if the child has been suffering from these separation anxiety and he's been diagnosed to be suffering from separation anxiety, he or she may also come up with these school refusals. So one should know how to deal with these separation anxieties. We've already dealt in with the etiology of separation anxieties and the causative factors that basically go on to developing these separation anxieties. If we have the physical symptoms of the anxiety and the panic disorder, for example, the raised heart rate, the respiratory rate is raised, the sweating is observed, tremors are there, all of these physical symptoms should be dealt in with depending upon the situation of the child. And empathizing with the child is again very important. To get to know the child, to get to know the parents, and the counseling of the parents is a very important factor when we have children who are suffering from school refusals. So parental counseling is a very important section when we are dealing with the school refusals. Over here in this section, we'll be focusing on the causes of the school refusals first of all, and the etiologies will be discussed in detail over here, and then we'll go about to manage such cases of school refusals. What is the causative factors? A lot of kids who are suffering from even the autistic spectrum disorders, they would come up with the school refusals. Then we have the prognosis of these children. Now, depending upon the causes and the causative factors that are leading to these school refusals, the prognosis is going to depend upon the causative factors. If it is the cause, that can be dealt in with quite nicely through the counseling sessions with the parents, the teachers, and the child can be involved in these techniques, in the development of the plans or the technique or the treatment modalities. Then the outcomes are sometimes very positive. In a lot of adolescents, they usually sometimes fail to respond towards these treatment modalities. So dealing with these school refusals at earliest as possible is the goal of a clinical psychiatrist or a practicing psychiatrist. So moving on, defining the school refusals is again very important. It's basically failure to enter the schools or the premises of any educational institute. It presents at an early childhood and especially during the times of transition. It's very important. Transition is basically characterized by the change of school, the change of placement, the change of city or even it can be the country. So sometimes the children refuse to go to schools due to the abrupt change in the environment. During adolescence, it peaks again usually, and due to the stresses of the adolescence and then the revival of the over-independent child-parent relationship. So these are the causes that can result in the school refusals, usually in the adolescent age group. So these are the peer pressures that the child is going to face when he's going to go to the college or to the universities. The increased demand of independence in the secondary school is one of the causative factor as well for the development of the adolescent college refusals or the university refusals. Then we have the presentations. Usually the child would go into refusal due to a bullying environment that he's facing in his or her school, told off by the teacher, and usually the child complains of headaches and abdominal pain. So this is the usual presentation. It is basically of the Munchausen syndrome, in which the headaches and the abdominal pains are not actually present, but the child is experiencing them or he's hallucinating them. The student actively engages in the academic and the social aspects of school. The student attends the whole day of school. The student begins to attend classes with the possible breaks. So if you have a child who is suffering from such kind of a school refusals, all of these techniques or plans can be carried out to basically make him attend the classes with breaks rather than a continuous attending the classes. This is going to basically add on to the factor that he's going to accumulatize to the environment of the school and basically the classroom. The student enters the school and stays in the office. The student gets on the bus or in the parent's car, and the parents are sometimes implemented towards the morning routine. So following a strictly based morning routine is again very important. The children usually get used to this morning routine. The management guidelines that will basically encompass are the education and health services. They usually play a pivotal role, and if it is something that is regarding the personality of the child, if he's suffering from ADHD or some sort of a behavioral disorder, then the child and the adolescent mental health services department should be concerned as well. The school should involve the parents and if possible the child for taking out the treatment modalities. The phased return should be planned and the cognitive behavioral techniques should be devised. Home tuitions are again very important over here. Now what basically happens is when the child gets the home tuitions, he gets more confident towards his curriculum and he can then get more acclimatized with the environment of the school and the classmates as well. So this is the management or the treatment guidelines that can be provided to the child, and sometimes the child is also involved in the development of these treatment modalities. So the relaxation techniques are taught to the child to help him cope with the anxiety if he is having it. Start with the child's single favorite class. Add the child's second favorite class after 7 to 10 days. Once the child is back to school, a full-time school routine should be followed, and time parent should be waited in the car, and basically the child should be more of the independent criteria should be involved in this treatment modalities. The prognosis, 1/3 of adolescents, they basically fail to respond to the treatment modalities. So it is very important to treat these school refusals at earliest at possible. So usually the children will respond well to the treatments. So in this section, we basically summarized a very important condition, which is basically characterized by the school refusals and how to deal with these children. So that is the end of the section. Thank you for watching sqadia.com.